Cancer is one of the most dreaded words in the entire world. It is the most devastating or a life-changing event that has ever happened to anyone. Statistics reveal that some 10 million people die every year from this disease, and about 12 to 15 million people join this group. And this figure is expected to increase over the next few decades. Additionally, cancer is a very costly disease. It creates a financial burden like no other disease. Therefore, I would like to remove certain myths and misconceptions in this disease. Because clearly, fear is not a solution to the problem. Number one is that it is a preventable disease. About 50 to 70% of cancers are preventable based on what we know today. Number two is that it's also a very treatable disease. By treatable, I don't mean curable. Curable is when the disease is diagnosed early during the course of its development. So cure gets possible when we diagnose cancer early. Cancer is a disease which does not develop overnight. Rather, it appears overnight, but the process of development is a long-standing one. Extensive research over a half century has indicated that inflammation plays a very significant and important role in cancer. In simpler words, our body responds to harmful agents that enter our body, be it through an infectious agent or any threat that happens to our body responds to it through presence of inflammation. That is, it creates a level of inflammation, and this inflammation is of acute nature, which means it comes and it goes on its own. It is of short lasting duration. Now, wherever it is present, it can present as a swelling, pain, loss of function, and also redness. An acute response to injury leads to acute inflammation, and this inflammation is protective in nature, which means it is good for us. So acute inflammation is helpful and it is healthy inflammation. However, what leads to cancer is the chronic inflammation. A chronic inflammation is one which is of low level intensity and it is present for a long duration of time. So the question is, what causes chronic inflammation? Chronic inflammation happens as a result of smoking, as a result of excessive drinking, then wrong food choices, having sedentary behaviors, unable to manage stress and trauma, and having infections in our body. Those infections that are not going even by treatments. As simple as it may sound, just by controlling our long-standing inflammation, we can significantly reduce our risk of getting cancer. Any inflammation which is of prolonged duration and is of low level intensity is far more dangerous than an inflammation that just comes, it is of acute nature, causes lot of pain, redness, and then disappears. Now, there are certain chronic inflammatory states in our body which many of us are having these days. A lot of us are having inflammation of the gallbladder, liver, pancreas, stomach, esophagus, and most of us are not paying attention to this low-grade inflammation which is constantly present in our body. And this inflammation is acting like a smoldering charcoal present inside of us. The doctors can do only a certain level of treatment to control this inflammation. We cannot truly ever cure this inflammation which is of low level intensity unless we make certain lifestyle changes. Now, making changes in the lifestyle, which includes eating healthy, avoiding smoking and drinking altogether completely, and being physically active, as well as managing our stress, managing our sleep, all these factors have a greater influence on reducing our inflammation. The drugs do only a little part. It is the changes in the lifestyle that have a better influence. And this influence is even more long-standing nature, and it is also helpful in reducing the risk of a large number of chronic lifestyle diseases. It's important for us to understand that any chronic inflammatory state or any chronic inflammatory condition that you may have needs addressal. It needs timely intervention, and your drugs that you're taking on a daily basis in the form of pills are just doing a limited role in reducing your inflammation. Unless and until you go to the basics of inflammation, you cannot truly bring about control. And you can also not bring about a control in your cancer risk. It's important we make changes to our lifestyle that favor reducing the inflammation. Thank you very much.